diagnosis. But remember, the final diagnostic, the definitive diagnostic of a thyroid nodule only can be done with biopsy. Ultrasound only helps, but is not the definitive diagnosis of a thyroid nodule. Detection. Of course, ultrasound is very good. Even in this case, you can see the mass in the neck. Sometimes you cannot see or palpate, and ultrasound let the doctor know there are a nodule in the thyroid. Differentiation. There are really no only sign of only one criterion about if a nodule is benign or malignant, but even there are different information that you can get with ultrasound that can help to differentiate the possibility of a nodule to be benign or malignant. The fundamental anatomic features of the thyroid nodule or high-resolution sonography are the consistency, the echogenicity, the margin, the presence of calcification, the presence of capsule, and the distribution of blood flow inside the nodule. All of this information helps doctors to know if the nodule is malignant or benign. Internal content. 70% of the thyroid nodule are solid. 30% are mixed or complex mass. Echogenicity. In general, cancer, not only from the thyroid, are hypoechoic because have a high metabolism, and that make cancers in general are hypoechoic, and of course thyroid cancer in general are hypoechoic. But also many benign nodules are also hypoechoic. The only criteria of hypoechoic are not enough to say a nodule are malignant. You have here a benign thyroid nodule that is benign. But when a nodule is hyperechoic, you can be pretty sure that is benign. To say hypoechoic don't mean malignancy, but hyperechoic have a lot of chance to be a benign nodule of the thyroid. The isoechoic nodule here have an intermediate risk of malignancy, and that means that isoechoic can be malignant or benign. Margin. When the margins are regular, that means that it's benign, and also that it's encapsulated. Of the contrary, with irregular border is an infiltrative cancer. This is more that is malignant. Borders are a good sign to know if some nodules are benign or malignant. Calcification. When the calcification are around the nodule, that means that are benign. But when the calcification are internal, called microcalcification, are more possible to be a malignant nodule. You can see here, microcalcification that means that this thyroid nodule have a big possibilities to be a malignant cancer. Pathology. Psammoma bodies are commonly seen in papillary cancers, and you can diagnose papillary cancer with the psammoma bodies. And the flow, the blood of flow. when there are a lot of flow in the nodules, you have more chance to have malignant cancer. (70 to 90% of the thyroid malignancy have internal vascularity with or without peripheral blood flow. Blood flow is other important information. Always you find a nodule in the thyroid, you must do color Doppler. The first picture in the superior area is peripheral vascular flow. The other two are internal vascular flow. Even though no sonographic feature is pathognomonic, that means that it's real to know if the nodule is malignant, there are high sensitivity and specificity with ultrasound, and that helps the doctor to have the decision to make a biopsy. Ultrasound cannot say if a nodule is malignant, but can help you to know if one nodule is more suspicious than other to be malignant or benign. Biopsy guidance. Ultrasound helps the doctors to localize and to make the biopsy of the nodule. In this case of the picture, the nodule is very big, but sometimes nodules are not as big, and ultrasound helps the doctors to perform biopsies of thyroid nodules. Even the diagnosis of hyperthyroidism is not really an ultrasound diagnosis, it's more a laboratory and clinical diagnostic. This is a very important disease of the thyroid that all sonographers must know. The etiology of the hyperthyroidism, logical, is the production of too much thyroxine by the thyroid gland. You can see the face here of a person with hyperthyroidism. This is called grave disease, and one of the most typical signs of the hyperthyroidism are in the eyes. You can see here the protuberance is in the hyperthyroidism patients. Hyperthyroidism have tachycardia. This is a heart faster beating. Heat intolerance. These people cannot tolerate heat. Weight loss are a very thin person. Warm, moist skin. Sometimes have goiter. Infertility and a typical tremor. This is the typical sign of hyperthyroidism. Of the contrary, hypothyroidism is little production of thyroid hormone by the thyroid, and in general the sign of the person that suffers hypothyroidism are the contrary of the people that have hyperthyroidism. You can see a person that is